We have breaking news on the coronavirus pandemic. The CDC is updating its guidance to say fully vaccinated people do not need to wear masks. This will apply to both indoor and outdoor activities, large or small. The guidance does not apply to healthcare settings, correctional facilities, homeless shelters, or on public transportation, or to those who develop symptoms. The new guidance comes as cases of COVID-19 have fallen dramatically over the past few weeks. The CDC stresses the science shows vaccines work and are effective in the real world. And there is growing evidence vaccinated people are less likely to spread the virus to others. CDC Director Dr. Rochelle Walensky made the announcement at a briefing earlier.
Anyone who is fully vaccinated can participate in indoor and outdoor activities, large or small, without wearing a mask or physical distancing. If you are fully vaccinated, you can start doing the things that you had stopped doing because of the pandemic.
For more on all of this, let's bring in Dr. Teresa Murray Amato. She is the chair of emergency medicine at Long Island Jewish Forest Hills. Hi, Dr. Amato. Great to see you. So this is a huge announcement coming out of the CDC, out of the COVID-19 response task force. Can you put this into perspective for us? What does this say about the state of the pandemic?
Well, I would say that I certainly don't have a poker face. The smile is just from ear to ear right now. This is wonderful news, what we've been waiting for over a year during this pandemic crisis. So this is really, we knew the way out of this crisis was the vaccine program. And so to hear that once you're fully vaccinated, that you can really have the freedom of taking off your mask and starting to do the things we did before COVID hit is just the most wonderful news and what we've been waiting for. Just realize that although this is sounding like it's coming so very quickly, first it was outdoors and then a few days later it's okay to be indoors. Just realize that this is all based on science and that they're looking at the numbers and the transmittability of the virus once you've been vaccinated. And it really does seem like we're in a really great place. We just got to get as many people vaccinated as we can over the next few days to weeks. And really life as we used to know it is really starting to come back. I just want to put a little caveat with that. The taking off the mask indoors is wonderful. But if you're a healthcare worker, if you work in a hospital or a nursing home, if you're going to be traveling on trains or buses or airplanes, they're still going to recommend to be wearing the mask, and I think that that's generally a good idea. But it is going to be interesting to see people's faces again in public.
Absolutely. And I'm curious about what this means in terms of the variants. Does this prove that health officials are no longer concerned about how vaccines protect against the variants?
So I think you still have to be concerned about variants, but we know the only way that we get these variants is when we have the transmission of the virus. So really the way to combat these variants is to combat the transmission of the virus. And again, if we can get enough people vaccinated, then there won't be any more transmission of the virus and it won't have a chance to mutate and have a variant. So I think it's not that we're not thinking of the variants, it's just the way that we're combating them is through the vaccine program and really just stopping COVID in its tracks and not letting it spread to another individual.
I want to break down what this means sort of on a practical, everyday, way, because right now you walk into a store and almost every store says you need a mask to enter. And of course, these are private businesses. It's fully within their rights to continue that if that's what they want to ask of people walking into their stores. But let me make sure I understand exactly why the CDC is saying vaccinated people do not need to wear masks. You are protected if you're vaccinated from getting it. That means you are probably also not spreading it. So if you are someone who isn't vaccinated but just doesn't feel like wearing a mask, you're really only putting yourself at risk, not other people in the room who are vaccinated, correct?
Well, yes and no. I would say that we know that vaccines are not 100% effective. We know that no vaccine is. So there's always going to be some breakthrough infections. So this is a difficult time, right? Because we have some people who don't want to be vaccinated and don't want to wear a mask. And are they posing some sort of a threat to people that are vaccinated? I think that's going to be really hard to sort of tease out. And I think one of the reasons we sort of waited to tell people to take their masks off was because there was that concern as how are we going to know when people are vaccinated? Nobody wants the vaccination police that are going around, show me proof of your vaccine before you take your mask off. I don't see that happening. But I think looking at how we came through this, together, I think it's really important that, you get your vaccine. We know it's safe. We know it's effective. The quicker we get people to take it, the sooner we can all start taking our mask off safely. But yes, the risk to the unvaccinated person is probably a much higher risk than for the vaccinated person, but it's not zero.
Right.
So, we just want to make sure we're telling people that. So it's still important to get your vaccine. Mm-hmm.
That's important to know. So if you are vaccinated and you feel worried that you may be entering a space, let's say a concert or a crowded area, where you're not confident that everybody who's maskless is also vaccinated, then you can go ahead and put on your mask if that makes you feel more comfortable, correct?
Yeah, so mask wearing is sort of, I tell people there's the emotional side and then there's the scientific side. Mm-hmm. And what I have learned through COVID is that you can't tease out sometimes what's emotional and what's scientific. And that's understandable. It's been a very long journey, and many of us have seen some really horrific outcomes from COVID. So the comfort level of not wearing your mask, it definitely has a little emotion to it. I can tell you personally, I went for a bike ride just a few days ago without a mask, and I felt almost like uncomfortable. I wasn't around anyone else. I was just riding a bike by myself. But, that freedom of taking the mask off, it's great, but it's also a little disconcerting right now. It's going to take time to get over that concern and that fear. Mm-hmm.
Yeah, it's almost like going outside in your underwear. You feel very exposed somehow. So, Doctor, the CDC is reporting that right now over 45% of adults are fully vaccinated in the U.S., but they are aiming for that 70% number by July 4th. And that would really make everybody feel a lot better, especially about taking off their masks. Does that number look realistic?
I think with everything, we had that big run on the vaccines when they first came out. There were a large group of people that were early adapters to the vaccine and the thought of getting the vaccine. We have seen some vaccination hesitancy, but I think there's also difficulty with access to the vaccine. So, and then again, the pause with the J&J also made some people really take a minute and think of whether they wanted the vaccine. I do see that we're starting with an uptick of giving the vaccines, and my organization, we're getting very creative with ways of getting these vaccines to the patients. And so we know, I work in a very diverse community that don't have a lot of access to private vehicles, so really relying on public transportation. And when your vaccine pod is not on that bus route, you're giving a whole group of people an inability to get that vaccine. So the onus is now on us as healthcare providers to make this where nobody should have to worry about not being able to get to the vaccine. And I think that's going to be,
right.
We're going to have to be pretty inventive and find a way to get it to everybody.
It's just incredible thinking about what's going on in some other areas of the world and how they are still struggling so desperately with this virus. And I think of places like India and Brazil. And it just puts into relief how fortunate we all are to have access to the vaccine the way that we do. And it really, I went to CVS this morning and was able to book appointments for my 14-year-old and my 12-year-old. And I just thought, this is incredible, because, of course, just yesterday, the CDC recommended Pfizer's vaccine can be given to adolescents as young as 12. Could this new guidance on the masks also encourage parents? Because, up until now, the child was sort of the weak link. Both adults could be vaccinated, but their children were not, right? So how do you handle the mask wearing or the not mask wearing if the rest of your family's not vaccinated?
So I can answer that professionally and personally. So my youngest is finally eligible, and we have her vaccine appointment for Saturday. So I again, having seen what I saw during the first surge of the pandemic, was very interested in getting all of my kids vaccinated as quickly as possible, because it will open up things like travel and being able to be at gatherings. I have my oldest is getting married in June, so we're very excited that my youngest is the last one who will be fully vaccinated for the wedding. But
congratulations.
Thank you. But I would say professionally, I have been giving a lot of advice to patients and to families about, the vaccinating the children. From what we have seen from the studies, it looks like it's a very safe vaccine with little side effects, and the benefit of not passing on that COVID virus to a vulnerable family member, I think, far outweighs any risk of getting the vaccine. Once again, most of our young folks did quite well with COVID, with some few exceptions, but it's really the concern of them passing it on to a loved one that's at a much higher risk of a poor outcome. So I would encourage parents, if you're concerned, if you have any thoughts about, getting it or not getting it, this is a frank conversation you have with your pediatrician. Ask all the questions you need to ask to feel comfortable. But know that, the studies coming out from Pfizer really look great. And so I can't wait to get my youngest vaccinated, and then it'll really be fun to start to think about moving to the new normal.
I'm right there with you. And can you imagine if a bunch of kids are vaccinated by the fall, maybe even masks would be off for schools? That would be another huge accomplishment. All right. Well, Dr. Teresa Amato, thank you so much for joining us to discuss this exciting news. We appreciate it.
Thank you for having me.